Hi, I'd like to make an appointment to see Dr. Johnson, please.
Good morning. Of course, I'd be happy to help you schedule an appointment. Are you a new patient with us?
Yes, I am. By the way, what does schedule an appointment mean? Is it different from make an appointment?
Oh, that's a good question. Schedule an appointment and make an appointment mean the same thing. We use them interchangeably. They both mean to arrange a time to meet with someone, like a doctor.
Thank you for explaining that, Sarah. Yes, I am a new patient. My name is Michael Chen.
Thanks, Michael. We'll need to fill out some paperwork before your first visit. Could you come in about 15 minutes before your appointment time?
Before my appointment time, do you mean I should arrive early?
Exactly. When we say come in before your appointment time, we mean to arrive early. This gives you enough time to complete the necessary forms.
I understand now. When is the next available appointment?
Let me check our availability. We have an opening next Tuesday at 10 a.m. Or if that doesn't work for you, we could fit you in next Thursday afternoon.
Sorry, but what does opening mean in this context and fit you in?
An opening is a free time slot in our schedule. And when I say fit you in, it means we can find a time for you despite having a busy schedule. They're common phrases we use when talking about appointments.
That's helpful to know. I think Tuesday at 10 a.m. would work better for me.
Perfect. Now, would you prefer to receive a confirmation by text or email? We can send you a reminder as well.
What's a reminder in this case?
A reminder is a message we send you, usually a day before your appointment, to help you remember the date and time. It's like a friendly notification.
Oh, that would be very useful. I'd like both the confirmation and reminder by email, please.
Could you spell out your email address for me?
What do you mean by spell out?
When I say spell out, I mean to say each letter of your email address one by one. This helps avoid any mistakes when I write it down.
I see. It's michael.chen@gmail.com.
Thanks. Now, I should mention that we have a cancellation policy if you need to reschedule or cancel.
Sorry to interrupt, but what does cancellation policy mean?
A cancellation policy is a set of rules about what happens if you need to cancel or change your appointment. In our case, we ask for at least 24 hours notice.
You mean I should tell you one day before if I can't come?
Exactly. That's what 24 hours notice means. It gives us enough time to offer the slot to another patient.
Got it. And what happens if I'm running late for my appointment?
If you're running late, which means you'll arrive after your scheduled time, please call us as soon as possible. If it's more than 15 minutes, we might need to reschedule.
Thank you for clarifying. What should I bring with me to the appointment?
Please bring a valid ID and your insurance card if you have one. Also, if you have any relevant medical history or are taking any medications, please bring that information along.
What do you mean by valid ID?
A valid ID is an official up-to-date identification document like a driver's license or passport. Valid means it hasn't expired.
I understand. And is there anything I should do to prepare for the appointment?
Yes, it's best to arrive with clean teeth, and if you're coming during your lunch break, try to eat beforehand.
During lunch break? Does that mean while I'm taking a break from work for lunch?
Exactly. The lunch break is the time you take off work to eat lunch, usually around midday. Many people schedule their appointments during this time.
That's good to know. One more thing. What if there's an emergency before my appointment date?
If you have a dental emergency, meaning severe pain or injury, just give us a call and we'll try to squeeze you in sooner.
Squeeze you in? Is that similar to fit you in?
Yes, exactly. Both squeeze you in and fit you in mean to find a time for you, even when we're very busy. We often use these phrases when talking about urgent or emergency situations.
That makes sense. By the way, do you accept insurance for dental treatments?
Yes, we do. We accept most major insurance plans. Would you like me to check if your insurance is covered?
What do you mean by covered?
When we say something is covered, it means your insurance company will pay for all or part of the treatment. Can I have your insurance information to verify coverage?
Of course, but what does verify coverage mean?
Verify coverage means to check with your insurance company to confirm what treatments they will pay for and how much they will pay. This helps avoid any surprise costs later.
I see. Should I bring my dental records from my previous dentist?
Yes, that would be very helpful. We can also request them on your behalf if you sign a release form.
A release form? What's that?
A release form is a document that gives us permission to obtain your medical records from your previous dentist. When you sign a release form, you're authorizing us to access that information.
That's helpful. Also, sometimes get very nervous at the dentist. Do you offer any special services for anxious patients?
Yes, we do. We offer what we call sedation dentistry for patients who experience dental anxiety.
I'm not familiar with that term, sedation dentistry.
Sedation dentistry means using medication to help patients relax during dental procedures. It's also sometimes called sleep dentistry, though you're usually not fully asleep, just very relaxed.
That's good to know. And what forms of payment do you accept?
We take all major credit cards, debit cards, cash, and we even offer payment plans for larger procedures.
What exactly is a payment plan?
A payment plan allows you to split the cost of your treatment into smaller monthly payments instead of paying the full amount at once. It's a way to make expensive treatments more manageable.
That's very helpful. One last thing, is there parking available at the clinic?
Yes, we have complimentary parking in the rear of the building.
Sorry, what does complimentary mean in this case?
Complimentary means free. You don't have to pay for it. It's a polite way of saying something is included at no extra cost.
Before I go, I was wondering about the different types of dental services you offer.
Of course, we provide a wide range of dental services from routine checkups to more complex procedures.
What do you mean by routine checkups?
A routine checkup, also called a regular checkup, is a basic dental examination where we clean your teeth and check for any problems. We recommend having one every 6 months.
Every 6 months, is that what you call biannual?
Exactly. Biannual means twice a year. You're getting good at these English terms. We also use the word semi-annual to mean the same thing.
And what kind of emergency services do you provide?
We handle various dental emergencies like severe toothaches, broken teeth, or lost fillings. If you have what we call an acute dental problem, we try to see you as soon as possible.
Acute dental problem, that's a new phrase for me.
An acute problem means it's sudden and severe, requiring immediate attention. It's different from a chronic problem, which develops over time.
I see. Do you also do cosmetic dentistry?
Yes, we offer various cosmetic procedures. Would you like me to walk you through them?
Walk you through, what does that mean?
When we say walk you through something, it means to explain it step by step in detail. It's like guiding someone through information.
Yes, please walk me through the cosmetic procedures you offer.
We provide teeth whitening, veneers, and what we call smile makeovers.
A smile makeover, that sounds interesting, but I'm not sure what it means.
A smile makeover is a comprehensive treatment plan that might combine several procedures to improve your smile's appearance. It's tailored to each patient's specific needs.
And do you offer any sort of consultation before these procedures?
Yes, we always start with what we call an initial consultation or a preliminary appointment.
Could you explain the difference between those terms?
They mean the same thing. It's your first visit where we discuss your dental concerns and create a treatment plan. Initial and preliminary both mean first or beginning.
What about aftercare? Do you provide instructions?
Yes, we provide detailed aftercare instructions. We call it post-treatment care.
Post-treatment, does post mean after?
Exactly. Post means after. So post-treatment means after the treatment. Similarly, we use pre-treatment for things you need to do before the treatment.
And if I need to reach the dentist after hours?
We have an on-call service for after-hours emergencies.
What does on-call mean?
When someone is on call, it means they're available to respond to emergencies outside of regular business hours. There's always a dentist ready to help if needed.
That's reassuring. Do you also provide any written materials about dental care?
Yes, we have what we call patient education materials, brochures and handouts about various dental topics.
Is that like a dental care guide?
Yes, exactly. These materials serve as references or guides for proper dental care. They include tips for oral hygiene and explanations of different dental procedures.
And do you send out reminders for regular checkups?
Yes, we have what we call a recall system in place.
A recall system? What's that?
A recall system is our way of keeping track of when patients are due for their next checkup. We automatically send out notifications when it's time for your next visit.
Do you also provide cost estimates before treatment?
Yes, we always provide what we call a treatment estimate or quote before starting any procedure.
What's the difference between an estimate and a quote?
A quote is usually more exact, while an estimate is an approximate cost. However, in dental care, we often use these terms interchangeably.
One last question. Do you have any sort of membership program?
Yes, we offer what we call a dental savings plan for patients without insurance.
Do you elaborate on what a dental savings plan is?
A dental savings plan is a membership program where you pay an annual fee and receive discounted rates on our services. It's like having your own in-house insurance plan.
Thank you so much for all this information. You've really helped me understand both the dental services and these English terms better.
It's my pleasure. Don't hesitate to ask questions during your appointment too. We want all our patients to feel comfortable and well informed.
Thanks again, Sarah. See you on Tuesday.
Looking forward to it, Michael. Have a wonderful day.